Good morning, everyone, and welcome to today's MSP Wellness webinar, Navigating Vaccination Mandates and Testing Protocols. My name is Christine Levins. I'm the Vice President of Strategic Initiatives for the Minneapolis Regional Chamber and a member of the MSP Wellness team. Thanks for joining us today. We hope we have a really good program for you that you'll take away some great ideas, some best practices, and some insights where we are in the current landscape around vaccinations. Opportunities to do policies, communication, etc. We've got two great presenters here with us today. Debbie Morgan from MRA and Claire Cochran, co-founder of Vault Health. They've got a great show for you, great presentation. And if members of your team did miss this today, we are recording the event, which I think you know when you came on in to join us today. So with that, I'm going to hand things over to our experts. Invite you to put your questions into Q&A. If you want to let us know you're here, if you want to put your name and organization into the chat, you're welcome to do that as well. So with that, I'm going to turn things over to Debbie.
Good morning, everyone. Thank you for joining us, and thank you for inviting me to be part of your presentation. Really great topic, super relevant right now. Even though the ETS was kind of shut down and it was dismissed, this is still a very relevant topic of conversation. So I am going to be joined by Claire this morning, and we'll give you a little more information on that. For those of you who aren't familiar with MRA, we are an employer organization that really works with employers, HR, and other leadership within companies to provide HR solutions and resources for your company on pretty much anything that you would need to move yourselves forward, find information on things that you are unsure about, or you just want additional information on. So I think we can probably just jump right into the presentation here. I'm going to start with a little information on where everyone is at. You know, in Minnesota, the state has pretty much decided to follow OSHA guidance. So again, with the ETS being dismissed, there are no vaccination requirements right now in Minnesota, and they've chosen to follow OSHA. Basically, it reverts then to the general duty clause, which, as you can see there, states basically that employers need to do what's in the employee's best interest to keep them safe, protect them from harm, disease, and with that does come kind of inherently protection against COVID infection within the workplace. So as long as employers are following safety protocols for cleaning, masking, when in areas of high transmission, you should be just fine and in line with the general duty clause. However, that does still put some of the responsibility onto the employer that if you know there's an outbreak, or if you know that someone is in the workplace and that has tested positive for COVID-19 or any of the variants, that you are sending that person home immediately, requiring them to get tested if they haven't already, and notifying anyone that may have been in close contact with that person. Minnesota also has chosen to follow CDC guidance in regard to masking and quarantine and isolation periods. Quick overview of that. For now, OSHA kind of has two categories for vaccinated individuals. You are considered fully vaccinated if you've received both doses of either Pfizer or Moderna, and it's at least 2 weeks following your last vaccination. And for Johnson & Johnson, it is the one dose, and then 2 weeks following receiving that. You are up to date on vaccinations if you've also received the booster shots, and 2 weeks has passed after that as well. So the quarantine time now is 5 days if you've been exposed or if you have tested positive. It's pretty much all of Minnesota guidance is following that. There are some more locally specific guidelines, more in the way of masking, but Minneapolis also has they have the vaccination or test mandate in place for workers or patrons of indoor dining venues. And what that means, if you aren't familiar with that, is You must be vaccinated and be able to show proof of vaccination if entering any of those facilities. If you are not vaccinated, you need to show proof that you have received a negative test result within the last 3 days. Now, that only goes for patrons, by the way. It is not for employees, although I think a lot of employees probably will end up following along with that, mostly just because they will be patrons themselves. It's not to say they would or wouldn't, but the requirement isn't there for them, so employers don't have to worry about making sure all of their employees are vaccinated or collecting cards. Masks are required for places of public accommodations, so any city-owned properties require masks. In St. Paul, they also have the vaccination or test mandate in all licensed businesses and city-controlled facilities. That is the majority of St. Paul, so most businesses are going to require that same vaccination or test mandate, although it is expected that that is going to be dropped soon, not confirmed, but it is something that they're looking at right now. Originally, that mandate would have gone through the end of February. There is talk that it may be ended sooner than that, though. So I guess that's something to keep your eyes on. So even though there are mask mandates, or if in a lot of areas they haven't been dropped, that still doesn't alleviate the employer from the responsibility of communicating what your policy is, creating a policy, whether you're requiring masking and vaccination or not. You need to let your employees know what your policy is and what your expectations are, so there's no gray area and people don't have to worry about being in violation of, or if you see people going against your policy, you don't have to implement any type of disciplinary action. If you are implementing a mask or vaccination requirement in your company, make sure you're allowing for accommodations as well for both medical conditions and also sincerely held religious beliefs. The cost burden is on the employer if you do require vaccination or if you require testing. So if that is something your company has implemented, know that you will either need to reimburse employees or make arrangements to have those tests paid for prior to them taking them. It's always an option to make testing and masking optional if it isn't a city requirement or required in the area that you are operating. Again, make sure communication is up to date, make it very clear, and have a policy in place for employees so that they can understand what your stance is. Again, if you are going to require either of those, the cost burden does go upon the employer. So at this point, I'm going to turn it over to Claire, and she's going to talk about some solutions if you are requiring masking or if you're requiring testing, I'm sorry. They have some great information to share with you.
Thank you, Debbie. I'm Claire Cochran. I'm one of the co-founders of Vault, and we have a large presence in the state of Minnesota. So very much appreciate the opportunity to speak with you today on this new normal. In today's presentation, I'll take you through a few of our testing options, both PCR as well as rapid testing options. And we'll walk through some case studies. So different organizations and companies based in Minnesota as well as throughout the country, and how they are using our solutions today to keep their workforce safe. Just a little bit of background on Vault. So we've done 12 million tests to date, 5 million telehealth consults. This is something where I think we're most famous for our supervised saliva test with our friendly Vault test supervisors who many Minnesotans have interacted with. And we service 3,500 government as well as enterprise organizations. So we pulled a lot of the case studies from these different companies, and hopefully you'll find some ideas or potential solutions to help as you continue embarking on kind of this new normal. Within the state of Minnesota, we've processed 1.7 million tests at our Oakdale, Minnesota lab. And the white markers that you see on the map over here are various on-site community testing centers. Also throughout the state, we have a number of organizations that we service, both with Vault staff, as well as our at-home supervised tests. So we'll go into more details on these various solutions in the next few slides. Our objective is to eliminate a lot of the administrative and logistics burden that employers and organizations may feel today with dealing with, the evolving landscape that is COVID. So we have a number of different solutions here that we'll go into. What you're probably most familiar with from a number of the community testing sites is what we call our individual PCR tests. So that's the saliva tube that you'll see at a number of those sites. We also do this as a pooled option, which we'll go into a little bit later. But on that front, the nice thing about that is it eliminates a lot of cost. So there's some substantial savings. And then we have rapid testing. So we have a number of rapid antigen tests, which results in 15 minutes. We offer those either self-administered or you can join a Zoom similar to what you do with our saliva PCR test, where Vault will help walk you through the test and then issue you a result that you can use to travel or get into an event, et cetera. And then we have what's called a rapid molecular test. So this is a 30-minute PCR quality test. It's a shallow nasal swab. So again, it's a great option if you're looking for high degree of accuracy with what you would normally get from a lab-based PCR option, but one that can be done at home. So it's a really great solution there. And then I'll take you through a little bit about our vaccine tracking solution on the next slide. This is a solution that if you do, need to assess, what percentage of your workforce or what percentage of your conference or event is vaccinated, and then have a testing solution for folks that are not fully vaccinated. This is an awesome solution for that. It's very customizable. So what will happen is we'll give you a dashboard where you can enter all of the emails of the folks that are attending a conference, an event, or going back in person. We will send them a customizable email on behalf of your organization. They'll click the link and then they'll simply fill out a few quick questions and submit some documentation around their vaccine. So the great thing here is it'll help you give some background and baseline data that you can use to then decide how you want to handle masking in the office if you do have optionality, or testing if you do have optionality, how to potentially segment your workforce. Critical workers might have a different cadence potentially for testing versus other folks that are maybe, able to have more optionality about coming into the office. So this vaccine status collection software can be used for workforce as well as conferences, events. And we also partner with Clear Health Pass. So if you, are going to a sports game or a large event that does leverage that, this data is all transferable into their system as well. We'll go through more case studies that generally fall into one of these three buckets around testing. So testing your workforce, whether that's PCR or rapid testing, events and conferences. This is, it's really exciting to see more events and conferences come back. And how can we help you ensure that that's done safely, as well as travel. So a lot of the travel requirements are evolving. Currently, to get back into the US, you need to take an antigen test. To go abroad, there's various testing requirements that fall into a number of different buckets, whether that's a rapid antigen test, a rapid molecular test, or a PCR test. So those are all things that we can help you with, especially as you're getting back to life. So the next couple slides, I'll go through a few different case studies, and hopefully you'll find some different tidbits or potential ways to help you think about how to navigate your own workforce. So in terms of manufacturing, this is a really interesting one. This is with a large consumer goods company. They have close to 15,000 employees across 5 locations. So what Vault did was we went in twice a week to each of those locations, and we staffed their on-site testing events that covered both their first shift and their second shift. And we would have the workforce complete tests twice a week. Sometimes those were PCR tests, sometimes they were antigen tests. But essentially what this resulted in is the positivity rates never exceeded 1%. And the specific county that this, these factories are located in had positivity rates approaching like 20 to 30% at times. So this was a huge win because they didn't have any factory outbreaks or shutdowns, even throughout a few of both the Delta surge and the Omicron surge. So this was a really efficient way for us to get folks tested in and out before they reported to their shift. The antigen test, gives them results in 15 minutes. So this wasn't, a huge time commitment for the company. And we were able to essentially segment the folks that were positive before they, got in close contact and potentially took out an entire manufacturing line. So this was a really successful way to handle folks that were obviously extremely critical to their production and their supply chain needs, with both a cost-efficient solution, especially using in transitioning from PCR to antigen testing. The next one is, again, more critical workforce, but this was actually an energy company that has 17,000 employees. And those folks are spread. Some of them are in, plant locations. Others are actually in mobile units. When you see kind of the utility trucks on your road doing work, those types of units, and those can be deployed, to pretty remote parts of the country and of the state as well. So this particular company took a bit of a hybrid approach. So in their highly concentrated plant locations, they used our lab-based PCR test that went back to the Oakdale lab. And then in their more remote areas or with their mobile units, they actually used the 30-minute molecular test, which you see here on the right side of the screen, which is the Lucira test. And the nice thing about this is it's a PCR quality test. It's super easy to administer. You can self-collect, self-administer it. And it illuminates with the results very clearly. You will see whether you are positive or negative with a bright green dot right on that device within 30 minutes. So this was really easy for their workforce to complete on their own, no matter where they were located, even if they were way up north, almost on the border. And then the great thing about this one is it also resulted in no outbreaks, and they didn't have any infrastructure downtime, which was obviously something that they are very much focused on, especially as a highly regulated entity. So this is a nice way to basically segment your workforce. The folks where you have highly, concentrated, you can use, one type of testing method, and then folks that are spread out or maybe don't have access to, be able to send something back via UPS, you can use the rapid test. The next case study we'll go through is actually a large insurance organization. They have about 13,500 sales personnel all throughout the country. And they were leveraging antigen tests to get back to in-person and client meetings. So they were leveraging the BD Veritor at-home test, which comes with 2 tests in one box. And the cool thing about this one is that we were able to ship them throughout the country. So we would send these boxes to their sales staff at their home. And then when they had an in-person meeting, they would take this the night before. It's a really slick app. It walks them through with really nice, clear videos how to do the test. And then right on their phone, it would provide them the documentation they needed to go into a client meeting that they tested negative and the date and time they took the test. And then because these came in a 2-pack, 2 days after the meeting, they would test again using an antigen test. And again, they just, ensured that, obviously no one was potentially, bringing the virus to any meetings. And then it gave their employees peace of mind after the meeting as well. So this was a really nice solution, and it was pretty slick because it's not like the company had to mail out these kits. We took care of all of that. They send us a spreadsheet. These are all the people that need tests. This is where we want them sent to. This is the count of tests. And then, essentially, it helped alleviate a lot of the employee concerns. And it actually helped with retention, which was really helpful, especially, when you look at some of the headlines we see with how hard it is to recruit and retain great talent at this time. A lot of folks don't necessarily want to go back in the office. And I think this was a company that was experiencing some of those headwinds. But enabling those individuals to test with high frequency before they had to go back in really helped alleviate a lot of that concern. The next case study, this is one of my favorites because I know everyone at Vault, we're really big sports fans, and I know there's a lot of golfers in Minnesota as well. So we partner with the PGA Tour and we test both players and staff prior to travel. And as I'm sure you've seen, Hawaii has some really strict, requirements to get into the island. And some of these international tournaments that these folks are participating in also had really strict requirements. So this is all, whether they were going to the Olympics in Japan or the tournament in Saudi Arabia that happened recently. These are all ones where the players, the staff, they all leveraged the Vault test to get in and get results and have the right documentation. And, when these tournaments would take place, obviously they're televised. So having, a player or a staff member that's unable to do work or unable to compete obviously has pretty large implications. So there have been 0 COVID cases on site with the start of the season. And this has been a really big success as well for PGA Tour because it also brought them a lot of savings. So previously they would have these large mobile units, almost like a tractor trailer with a lab in it, which, as you can imagine, can be really expensive to operate. And they switched to those 30-minute Lucira rapid molecular tests. So they have the same PCR quality test as they were getting in this, 53-foot trailer, but they don't have nearly the expense of operating that. So this is a really big win. And we securely manage all of the data. So, the players will test, they'll meet a Vault test supervisor on Zoom. We document the results. They get the documentation they need to enter the tournament or enter the country. And then it comes in a really slick dashboard where the tour can ensure that everyone who needs to test got tested prior to arriving on site. So really awesome opportunity, to keep sports on TV and, ensure that we're doing it safely. The next case study is around travel. So very similar to sports, a lot of different countries, different places have some pretty strict travel requirements in order to enter. Both travel, I call it high stakes testing because you never want to be the reason someone can't be in, on their Hawaiian vacation or wherever they're going. And this was one where there were 600 people coming from 400 different places. So in terms of complexity, it was extremely complicated. And they had a test within 72 hours of their flight. And it was a big incentive trip. So they had worked, the full year to be able to go to this event and be invited. And it was a really big deal for this company. And we actually did a full, worked with the company to come up with a testing strategy to ensure that all 600 people were able to enter on time, look for ways to pull some cost out. So where there were a high concentration of, folks that were living in a particular area, we set up drive-through testing centers in those areas. And then for folks that were in more remote places or where there wasn't a high concentration, we were able to do the at-home Zoom supervised test. So that was a really big win because, for this company that was investing a lot in this, renting out a huge Hawaiian resort, they really wanted to ensure that these folks, were able to come on time and that they didn't, have any sort of risk of infection. And this was a really great way to make it happen. So, we'll partner with your organization to come up with, the cheap and cheerful yet reliable solution to, ensure that your workforce, your event, your travel, your trip is covered. The cool thing about this too, our partnership with Clear Health Pass, these folks were able to connect their Vault account to Clear. Even folks that aren't Clear members, they were still able to make that connection. And then you get expedited entry. So this was great because they got off that plane and they were able to quickly process all these people and, get to the resort and enjoy their incentive trip. And then finally, this test to stay for banking center. So this was a large financial institution. They have about 4,300 retail locations throughout the country. And these are employees that are constantly interacting with the general public. And so what we've done in this case is we've sent our PCR tests to each of their banking center locations. And folks, when they have exposure or they don't feel well, they're able to very quickly test. They do that over using our saliva PCR test. They sign a HIPAA authorization. And so the bank can see all of the results. They can see who's testing, the frequency, and these folks are able to quickly return to work so that these financial centers, banking centers can stay open. So this is another example where, even though you may have a number of different locations, whether it's in Minnesota or throughout the country, we're able to ship and take a lot of that kind of administrative or logistics burden off and ensure that no matter where your employees are, they have a solution, they can take a test quickly and return to work or, stay in the office if there's ever a concern. So in summary, we will partner with you. We will help you determine kind of the right testing strategy for your workforce, whether that's rapid testing, lab-based PCR testing. And then, the nice thing too is it is a highly regulated space. So if you do need us to do on-site rapid testing, we actually will file all of the paperwork for our, what's called CLIA, which is one of the things that govern on-site rapid testing. And we will ensure that it's extremely streamlined. So you will know exactly who tested, they will sign a HIPAA authorization, you will have a slick dashboard, which you'll see in a second. So it eliminates a lot of the kind of administrative burden of having to figure out, what do I do and have folks on your various teams have to kind of manage this. We will take that off your plate. We will help you figure out what the right solution is, depending on what your workforce needs are. Our supply chain is robust. We partner with a few different companies, Lucira, Acon, BD on the rapid side. And we've got plenty of inventory of the PCR tests if you do want a lab-based saliva option as well. We have multiple fulfillment centers, but the one that's probably closest to all of you is our fulfillment center in Brooklyn Park. And that's where we have supply of all of these tests. So, folks will call us, they'll be in an outbreak situation or, hey, we have unexpected meeting or unexpected travel. We will, same day ship, we will overnight ship, just depending on what your needs are. We have a robust supply chain and a customer obsessed attitude. So I think that's why 12 million tests later, folks have chosen to partner with us for their testing needs. And lastly, on the HIPAA compliance and privacy and security side, this is something that we take extremely seriously. We are, medical practice. We are HIPAA compliant. We have our SOC 2 type 2 as well. And, we manage our data and our privacy and security in a way that is, best in class. So our staff is trained. They go through extensive training multiple times a year. We have a huge set of staff focused on privacy and security. We have organizations that will send us their security questionnaires. We will promptly address them. So these are all things that are, I know, near top of mind for your organization. And given that we are a medical practice and we do retain records in compliance with HIPAA, this is something that, we have the right infrastructure, the right controls in place to service, your organization and ensure that it meets your privacy and security requirements. With that, when folks do sign a HIPAA authorization, and that's optional, you can let us know if you want results or not. You will, on the left side of the screen, receive a results dashboard. This is all, illustrative data, no real patient data here. And then, over on the right side, this is just two examples of what, your employee or you would see. I'm sure many of you have taken a Vault test. You can log into your Vault account. You can get, the progress tracker. I think this is very similar to the Domino's pizza tracker. So you can see, where your sample is in process. You can download a PDF of your results and use that for, for travel or for event entry. So with that, we'd love to answer any questions. Debbie and I are here. So we're happy to answer any questions that you may have.
Yeah, I did notice one question that was put through the Q&A, and it was, let me read that question real quick. We recently had an employee call in sick and had taken 2 home antigen tests that were positive, and then the same day went to get a PCR test that came back negative. How are we as employers supposed to know how to proceed in that situation? Well, I can answer that based on what MRA's hotline would advise in that situation. And then Claire, if you have anything you want to add as well. At-home tests are great, and in a lot of cases, they're completely accurate. Although administering them at home without a proctor does leave a little room for error. PCR tests are more accurate. And if they went in and had a medical professional or someone who has been trained to administer those tests, most often those are going to be a little more reliable, a little more accurate. And if there is a discrepancy, we advise to go with the PCR results, especially if that is the more recent result. I don't know if you differ with your thoughts, Claire.
Yeah, I mean, I think I'm not a medical professional, but I think, one thing that our medical team would advise is, obviously, because they had 2 positive antigen tests, it's probably safer to keep them quarantined for the 5 days, and then have them, return when they're, not feeling any symptoms, et cetera. So with Omicron and some of these variants, you do see a little bit of, variability with some of these results. Like folks will clear the virus very quickly. So it is, there is some adjustments with these new variants that will come out. And, I'd advise you to meet with your, medical personnel and then just stick to the letter of your policy. So if they had a positive test, keep them, quarantined for the duration, that the CDC recommends or that is within your policy.
Yeah, absolutely. The CDC is still the guiding light for, for most companies and what everybody is watching. So yeah, exactly. I agree with Claire. Follow those guidelines. That's really going to be the best way to go.
I have a question here that kind of refers to record keeping. What are some of the things that companies should keep in mind? Claire, you referenced some of the tools that Vault has, but in terms of collecting the results, confidentiality issues, kind of upkeep of those files as people go through the vaccination course and boosters. Do you have some insights into that, Debbie?
Well, definitely, you're going to want to make sure that all of the records, any information that you're obtaining is held in a very confidential location. Only the people that need to know or need to see that information should have access to it. So I know a lot of companies have come to us and said, well, we need to advise supervisors if someone's going to be out or if someone needs to come off of their shift or if there has been an exposure. In those situations, companies should still protect the confidentiality and the identity of the individual. You can still tell a supervisor or manager that there has been an exposure. You don't need to tell them who. So let them know who has been exposed. But as far as keeping the records, for example, anything that would come through from Vault, make sure that you have a very secure place. If it's on your computer, protect those files and make sure that only the people who should have access to them have the password or have a way to get into those.
Yeah, and one thing to add, the nice thing about our dashboard is we can disable downloading of results. So you can let us know, like, I don't want it, don't want any of this, being able to get downloaded. We also can provision results by location. So for example, in the manufacturing example, the factory that had 5 locations, only the folks at site A are able to see site A's results. Site B will never see site A's results. So we're able to provision our dashboards by location, to ensure that we're also compliant with HIPAA's minimum use principle.
Thank you both. I think one of the other things folks on this webinar may be interested in is information or thoughts about the next steps for OSHA, knowing that some industries are specifically impacted by that course.
Yeah, absolutely. So there is a very lengthy process for OSHA to implement any kind of requirements. And although that they have dismissed the ETS, they are still working on developing regulation for workplaces. There is still a requirement for healthcare facilities to watch and make sure that their employees are safe, because just by nature, the patients will be at higher risk. Most of the patients that are coming in are already compromised or have compromised health conditions. So they need to take additional steps to make sure anybody that's coming in is safe. So the masking, and it's more likely that healthcare facilities are going to implement vaccination mandates as well. But it is expected that, it'll be before the end of the year. That is pretty sure. But OSHA is still working on developing guidance. We don't know yet what they're going to include in it. There are some thoughts that they will take the Supreme Court's advice in their final statements, and they may go the direction of saying only certain types of companies need to require vaccination or need to take extra steps. We don't know that yet. Something to watch for. It's not recommended that you start taking steps in that direction, because I think as we watched over the past several months, it's going to change direction several times. Once OSHA does develop these standards, it does need to go out for a comment period, and that can take several months as well. They do need to take those comments into consideration before implementing a final standard. The thoughts are probably by this fall we'll see something more permanent on that. But the ETS won't be in place. This will be something that is written into OSHA's standards for employers.
Thanks for that, Debbie. I think we have another question here, and we may have touched on it a little bit, but some tips and tricks or traps to avoid when communicating kind of policies or implementation strategies to employees. Claire, you referenced in some of the case studies, groups of employees that are, really diverse across a large geography. Some may have different roles. I know, we're hearing about larger corporations coming back to the office. Any strategies on how to best communicate these policies and implementation?
Yeah, I'm happy to take that one. So in terms of the companies that we work with, it's important to understand and survey the population. Some of the things that we encounter, depending on where we're testing, are language barriers, accommodations, accessibility. So those are all things that we are very experienced with. And what we've done in our pre-planning process with the companies is understand some of those dynamics on site. Is it a union workforce? Is it non-union? How many languages are spoken? Because the more prepared we are on day one with what kind of dynamic is happening on site, we can ensure our personnel are ready to handle those types of things. And in terms of the communication to employees before, it's obviously important to have a policy that's clear, that is succinct, and it's over communicated. So we find in a lot of workforce that we work with, they don't all have access to emails. Maybe they're on the shop floor. So, leveraging different communication tactics like an all hands or signage, things like that. So I think it's always helpful to over communicate, communicate in different ways, whether that's an email, signage, et cetera, and then ensure that you're transparent about different accommodations up front. It's okay if there's 8 languages spoken on site. We're used to that. But we need to make sure that we have the right staff on site or interpreters, et cetera, to help facilitate that. Or if you have a workforce that's not technologically enabled, that's okay too. We then, in that case, will staff extra folks so that they're there to help register people that are not, as literate with technology. So those are all things that I think are helpful to, really demonstrate to employees when you do that first testing event. Make sure that it's smooth. Make sure that it, they feel, how rigorous and how disciplined, the company is with rolling this out. And it's really important on day one. Even though it's day one, it needs to be professional, it needs to be organized. And so those are some of the things that we will work with you on to ensure that we're well covered, depending on the dynamic, on site.
Yeah, the one thing that I would add is also communicate with supervisors, managers, frontline management, so that the message is consistent and everybody understands how the policy is going to be implemented, what steps need to be taken if there is a positive result, as far as communicating to others on the shift or not communicating certain things as well, so that confidentiality can be kept.
Thank you both. We have a message in the chat here. Is surveillance testing useful in confined environments, like in a manufacturing setting? It is still useful or recommended?
So I think it depends on, a number of different protocols that you may already have on site, and social distancing, masking, what percentage of your workforce may be vaccinated versus unvaccinated. So that's a little bit of a tough one to answer, just given there's so many other dynamics at play. What are the positivity rates in the region? we do find that having tests on site, if someone does become symptomatic or doesn't feel well, you can quickly react. Or, doing surveillance testing on a weekly basis, if that's something that your company can financially, incur, given the criticality of the workforce. Those are all, different mitigating factors to ensure your location can stay operational. But again, testing is one line of defense. I think there's other, components that you'll need to weigh with your own policies, given the areas that you might be in, like masking and social distancing.
Thank you. Debbie, any other, kind of best practice ideas? And when we talk about the idea of forming policies, are there, recommendations on who you should consult with, or, where you take the best information from to, really update your policies and procedures, documents, manual, onboarding, et cetera?
Yeah, well, OSHA did release a policy or a sample policy, which is obviously going to be modified by most employers right now, but it does contain just the structure of what a lot of companies would want to include. It addresses the main things like when testing is required, what types of accommodations should be made. MRA also has several sample policies, and that information is taken from attorneys and what they recommend. I don't know that you need to go as far as consulting with an attorney, but you may want to have an attorney review your policy just to make sure that there would be no issues with discrimination, that you have the proper language to account for or allow for accommodations. The main things to include in your policy is to very clearly state what the company's stance is, who will be required to follow your company's policy, whether it's to mask and vaccinate, or if employees have the option to do that, and address any accommodations, how employees should request those accommodations, and that a company will consider them. The big thing is, do not make a promise that an accommodation will be made, because that may not be possible in all cases. In some cases, the accommodation may not be reasonable for the company. So it's best to just address that the accommodation will be considered and reviewed, and a determination will be made after that.
Can you elaborate just a little bit and just maybe give a couple of examples of what accommodation might be?
Yeah, if somebody comes and says that they are not able to be vaccinated, but your company works with the public on a regular basis, maybe you work with vendors or you hold contracts with companies that require vaccination, and the person that you're sending on site to work with those companies requires vaccination, even if your company does not, in order for that employee to work with that customer, they would need to be vaccinated. So if that is the only account that person works with, if that is the only area that person can work in and they cannot be vaccinated, it may not be possible for you to provide work for them. A reasonable accommodation is going to be very difficult in that type of situation.
Thanks for that example. Perhaps something else to, here we have a question. Can you give guidance on how to determine if a request for religious accommodation is legitimate?
That is the $1 million question. That is probably one of the biggest things that we hear, one of the biggest asks. Consistency is something that's been relied upon. So if you're in a type of facility, let's say every year you require flu shots, or you know that that employee has had flu shots in the past, and now they're coming and saying that they're not able to get the COVID vaccination because of a religious belief. Well, there's some inconsistency there, because basically it's the same type of procedure, it's the same kind of preventative action for the employee. So that's something that you could maybe question the person on and pursue a little bit further. There are a lot that come through and say, because of testing or things that are done before the vaccination is even released, that goes against their religious beliefs. You can look at other areas as well, like, do they take other medications? Because the similar testing is done for those medications as well. Those are just a couple arguments that we've seen and that we know some companies have used when people have made those requests. In general, honestly, most companies are accepting religious requests or requests for religious accommodations, just because the number that come through usually are smaller. So I don't know if that answers the question. Hopefully that does.
I think you did a fine job of tackling a question that is very nuanced and complicated. I think one last question, and I think you may both have some examples or some suggestions on how to do this. Debbie, inspired by your comments about accommodations and working with other clients, vendors, contractors, are there some best practices or techniques or examples that you've seen of successful coordination to know who you need to, what the policies are of folks that you're engaged with in your business practices? Any examples or ways to say to someone, this is our policy as a business, this is how we need to interact with you? I know that happens in the venue space amongst folks that are in construction, anyone who might be a subcontractor of, the federal government. Any insights from either of you or both of you on how to kind of manage those situations?
Yeah, I can start this one off, and then Claire, if you have anything that you'd want to add in as well. Again, communication is going to be key here. And, first of all, finding out who is and is not vaccinated, and communicating with anyone who is not vaccinated that there is a possibility they may not be able to go onto certain sites, work with certain customers who do require it. There may be accommodations that you can make in those situations, such as trying to find other accounts or other locations for that person to work. However, you don't need to go to extreme lengths to find work for those employees. If it's a requirement for them to be vaccinated, you run out of work that they can perform unvaccinated. I think you've pretty much done what you can do. Again, the key thing is communicate with everybody what your policy is, what procedures you're going to follow, and anybody that they may be working with that has the requirement of vaccination, so that they understand where their employment may lead.
Thank you.
You've covered it well.
All right. It looks like we have another one, Claire, if you don't have anything to tag on that particular question.
Yeah, I can take this one. The question is around if there's any creative ways that we've seen businesses partnering together to share in costs. For example, if they're co-located. So we have a good example of this, a building in the state of New Jersey where it's like a large office building where there's multiple companies. What we've done in that case is we'll do on-site testing events, and we have the inventory for each of the companies segmented. So an employee comes to it's like a large conference room / training center. They say what company they're with, and then our supervisor pulls the test kit associated with that company. And then this way, all of the companies in that building are able to share in the cost of the supervision, so the on-site supervision. And it just makes things a lot more cost efficient when you're able to kind of consolidate it with multiple companies volume. It becomes a much larger event, and therefore we're able to pull a lot of cost out. The other thing that we've seen too, for employers that have a lot of contractors on site, so this might be temp agencies like Manpower, Aerotech, or HVAC companies that are on site doing a lot of different work. We have one large manufacturer in particular that has 200 different subcontractors on site that need to be tested if they aren't vaccinated. And it's the same thing. The subcontractors actually purchase the inventory from us. Same thing, contractor, employee, they come to the testing center, they say what company they're with. Our folks pull a test kit from that inventory and proceed with the test. So if you do have contractors on site that, should be kind of paying their own way with testing, we're able to do that. We just set up a separate contract with them, and they can still, use your space, et cetera, to do the testing. But that's been one other way to solve for kind of some of the financial burden. It's not all on the, your organization.
Thanks. That's really helpful. Any other comments, Debbie and Claire, before I get us wrapped up for the day?
I think there's just one thing that I wanted to include. I think I kind of skipped over earlier in the presentation that, regardless of the requirements in your area, whether you're in Minneapolis, St. Paul, or other location that's requiring vaccination or masking, companies always have the option to implement those policies if they feel it's going to be in the best interest of their company, their employees, or the people that they're working with. Just again, be very careful. Make sure that your communication is clear, consistent, frequent, and that everybody understands the intent behind that. There may be some fallout. There may be some people who will comment on that within your organization. But again, being clear on where the company is coming from with that is going to be the best route.
Thanks so much. I want to thank Claire and Debbie for joining us today, providing all of this information. Again, we will include it in your post-event communication, as well as having it on the MSP Wellness website. Additional thank you to Kathy Packard and Melissa Reed for helping us bring this program together. The MSP Wellness program is a partnership between the Minneapolis Regional Chamber, Hennepin County, City of Minneapolis through the statewide SHIP program. Our focus is providing tools to worksites who are invested in employee wellness and well-being, and providing those tools for implementation and support. You can find out more about the program. We have a new microgrant program for businesses in the city of Minneapolis. Those applications just opened yesterday for worksite strategy implementation, as well as an MSP Wellness designation criteria. If you are a business that's heavily is working hard in the wellness space, you can qualify as a champion, benefit from recognition. So we encourage you to take a look at that as well. So with that, I thank all of you for attending today. Really appreciate your thoughtful questions. And again, thank you to Claire and Debbie. With that, have a great rest of your day. Thanks so much.
Thank you.
Bye-bye.
Thank you.